Hi, this video lecture is just going to cover a few extra herbs that aren't in previous videos about astringent and alterative herbs. We're going to cover the astringents Capsella, Geranium maculatum, Geranium robertianum, and alteratives Scrophularia nodosa and Berberis vulgaris. Capsella bursa-pastoris first. Shepherd's purse, and the second name bursa-pastoris means literally purse of the shepherd, and this refers to the distinctively shaped fruit capsule which people imagine looks like old-fashioned shepherd's purses, which are made out of goats' scrotums apparently. Anyway, shepherd's purse is in the bursa-pastoris family. It's upright, herbaceous perennial, has a basal rosette of pinnately divided leaves, but the stem leaves are oblanceolate like this. It has white four-petaled flowers in a cruciferous arrangement, and these give rise to the distinctive fruit later on, and we use the aerial parts of the herb. Constituents are flavonoids, glucosinolates like other brassicaceae, and some fairly pungent amines. Note that it doesn't appreciably contain any astringents, tannins, even though it is quite astringent, and there are one or two astringents like this, particularly if they're quite stimulating, which Capsella is. So the primary action is anti-hemorrhagic, to stop excessive bleeding wherever it is, and specifically has a use for dysfunctional uterine bleeding. It has an acrid taste, quite distinctive and pretty unpleasant, to be honest. I was just going to say about shepherd's purse, you might find it difficult to get your patients to take it, even if you disguise it with other herbs, so sometimes you have to give them the tincture and ask them to mix it with milk, and then they can just about swallow it. But it is very effective nonetheless, so it's worth using. Next astringent is Geranium maculatum, which is a North American herb introduced by the physiomedicalists. It's an erect, hairy perennial on a single stalk. The leaves are deeply divided. In this picture look a bit like buttercups, but it's not in the buttercup family. Has a 5-petaled flower, pale purple, deeply veined, and the fruit is a beaked capsule, giving rise to the name crane's bill. And we use the root and the herb of this plant. Contains gallatannins, which give it astringency, and Holmes describes it as dry, solidifying, as well as being cool, sweet and restoring. The main use is to stop discharge, leakage and bleeding, characteristic signs and symptoms of the over-relaxed tissue state. And in terms of conditions, we can use it for peptic ulcer, mouth ulcer and urinary incontinence. It's also useful to manage excessive lactation and excessive sweating, and has an application in hemorrhoids. There is a native European herb which is very common, in fact some people regard it as a weed. Herb Robert, Geranium robertianum. This is a bit milder than Geranium maculatum, but still quite effective. Very spreading, branching perennial, in contrast with the more upright maculatum. Deeply divided leaves of a very characteristic shape, once seen never forgotten, and it has a distinctive smell to it. It's slightly aromatic. Pink petaled, 5 petals again, but the anthers are orange or purple. And the whole plant goes red after flowering, in common with certain other plants that are associated with treating heavy bleeding. So it's like the whole plant is dripping in blood. So St John's wort does a similar thing. Another doctrine of signature thing is these cranesbill fruits stick to clothing and fur and hook onto things. And the Iroquois in Native America, according to one source, regarded as a sign that this plant can help you to hook back your integrity. So the sort of loose tissues, you sort of hook back that looseness and sort of firm yourself up. We use the leaves and the flowering tops as fresh as possible, really. Contains tannins, some bitters, and a trace of volatile oil. It's principally astringent, and Barker, not Barler, suggests using it for duodenal ulcer, diarrhea, metrorrhagia, which is heavy bleeding from the uterus of whatever cause, sore mouth, inflamed mouth, stomatitis, and cold sores. On to the alternatives, and first one is Scrophularia nodosa, which is commonly called figwort. We'll see why later on. It's in the that family, Scrophulariaceae, along with foxglove, romania, and verbascum. So interesting there. It's an erect, hairless perennial, square-stemmed. The leaves are opposite and alternate, broad-based and oval and pointed, and the flowers are lobed, cup-shaped, red-brown on the upper lobes and greener underneath. And the whole plant is a little bit like Lamiaceae, but the fruits are technically different, and it's got different kind of constituents and different sort of lineage. Anyway, we use the whole aerial plant, and it's better to use it fresh, according to Julian Barker. So what's in the name? Scrophularia nodosa. Well, scrofula is the old name for an illness that was called the King's Evil, prominent in earlier times in Europe, but still active in quite a lot of places in the world. It's an infective lymphadenitis, so infection of the lymph nodes caused by a tuberculosis bacterium, and characterized by swollen, painful lymph nodes, especially the cervical lymph nodes, itchy, peeling skin, and sometimes weeping sores in the skin from ruptured nodes that have burst through the skin. And the nodosa part of the name comes from the nodular roots. There's another species of Scrophularia in Britain, Scrophularia auriculatum, I think it is, water figwort, and that doesn't have these nodes, and it's not quite as potent and pokey as figwort. So, contains iridoid glycosides, in common with a lot in this family, and flavonoids. So, primary action is alterative, and it's a classic herb for dealing with damp, congested heat. The flavonoids also make it anti-inflammatory, and it removes obstruction of the lymphatic vessels and the lymph nodes. It's bitter, cool and dry, but also slightly pungent, dissolving and decongesting, so it gets things moving. We use it for chronic skin disease, externally and internally, especially with its congestion and weeping skin. And it can also be used for lymph gland enlargement, whether or not it's tuberculose and inflammation of the lymph glands. And it's also used for swollen and inflamed hemorrhoids, and indeed this is where the name figwort comes from, because the word fig was 18th century slang for piles or hemorrhoids. Slight caution with the use of it in heart conditions. There's a tradition of it being used as a mild cardiac tonic, although there's not very much evidence of there being cardiac glycosides in the plant, Of course, other members of the family, for example, digitalis, obviously have cardioactive glycosides, so caution is advised. Another alternative, Berberis vulgaris, has a common name of barberry, and you see here this is some stems with the leaf just emerging from the axils, and around the axil there's these really vicious thorns, 3-pronged spines, and that is absolutely characteristic of Berberis vulgaris. The leaves are oval, the flowers are yellow in drooping spikes, and then they turn to fruit which are bright red and oblong. And we use the root bark, fresh or dried, by preference. That's the most potent, but other parts of the plant can be used as well. Principal constituent is berberine, which is associated with the yellow colour, but I don't know if it accounts for all the yellow colour. And there's been a huge amount of investigation of berberine as an isolated constituent. It's a stimulant, tonic, hepatic, according to Priest. Bourne Mills note that it's choleretic, it increases the manufacture of bile, and it's cholagogue, it increases the flow of bile from the gallbladder. And it's really quite antimicrobial, and yeah. So the besides the hepatic actions, I suppose that makes it an alternative, but it's, that's a main use of it, and it's also stimulant to the digestion, antiemetic and laxative. So it's bitter, astringent, cold and dry, and the main use is in functional derangement of the liver and gallbladder, so non-obstructive jaundice, cholecystitis, that's inflammation of the gallbladder, and gallstones and biliary catarrh. It's also useful for the stomach, gastritis and biliousness. You can use it to relieve constipation, but you need a higher dose. Eczema of the hands, I think Priest says it's specific for that. Ruth Trickey is very keen on it for congestive dysmenorrhea, or period pain. I don't know if it's painkiller, but it's definitely a decongestant. And it's reckoned to clear the estrogen faster to help with fibrocystic breast disease. Now, as I said, there's been a lot of research on berberine, and some of that is looking to confirm traditional uses across the world. But attested uses are used for acute infectious diarrhea and giardiasis, so this giardia organism inhabits the gut, and if it overgrows can cause serious problems. So just to put it in perspective, that's the size of it, about 3 microns across, and your average intestinal cell is about 11 microns across, so it's that's the kind of scale of it. Can also be used for type 2 diabetes and elevated blood lipids, so that's that classic metabolic syndrome, which is to do with congestion and heat, and Berberis is good for dealing with that. And it's also used for leishmaniasis, which is a blood-borne disease which can cause some really nasty lesions on the skin. So special features are that it clears damp heat from the intestines, the genital and urinary system, and the liver and gallbladder. Holmes also goes on to say it's specific for treating chronic deficiency that's turned into stagnant heat. Running out of time. Dosage standard, but you need a higher dose if you're going to use it for some of the things that berberine is used for. Don't use it in pregnancy, and if somebody's in cyclosporine treatment, it can increase the likelihood of immune suppression. Thank you.